Hello, so my name's Amber Stewart. I'm the nurse practitioner in the emergency assessment bay, so I manage the unit. So we are located on Talbot Butler ward, sort of adjacent to it, and we're a 24-hour service. And we're there for patients that are receiving chemotherapy or immunotherapy and also radiotherapy within 6 weeks of treatment. And also for patients when they're immunotherapy, we actually see them for over a year. So there's an extended treatment window for that. We manage side effects of all these treatments, and we'll manage them in the unit if we can, and if not, we might have to then admit you onto Talbot Butler ward for management, and then you get discharged from there. But ideally, we're a unit where we try and avoid admission. Okay, so when you come in, so you'll phone the triage line via the emergency assessment triage number that you would have been given in your pre-chemo assessment. But if you're ever unsure of the number, you can always phone switchboard at Northampton General, and also ask the chemotherapy suite as well. So we have 3 patient trolleys, we have 4 recliner chairs, there's nurses in the unit, myself and another nurse, and sometimes 3 nurses, and then there's doctors as well in the unit. And again, we're for admission, assessment, treatment, decisions to admit and discharge. Okay, so with your chemotherapy, there can be many complications of your chemotherapy. It can make you feel generally unwell, you can get infections, you can feel tired, like decreasing in your eating and drinking, and you can become dehydrated. So all of these side effects of your treatment we can manage in the unit. So there's just some examples on the slide there. So hypercalcemia is when you have high calcium levels, and that can sometimes make you feel twitchy and unwell. Neutropenic fever, which is where your immunity drops, so specifically your neutrophil count, and when that drops, you're more likely to have an infection, and that's why it's really important that you check your temperature. Ideally, we say about 3 to 4 times a day, just to make sure there is no infection. And if you did have a temperature above 30, well, it's 37.5 or above, you'd be calling our unit and you'd be coming in. Spinal cord compressions, uncontrolled nausea and vomiting, which is we get that a lot in the unit, and again, unable to eat and drink would be the reasons. But if you're ever unsure, you can always have a look in the back of your chemotherapy book, which you'll be given on your pre-chemo assessment. But if you're also ever unsure, you can always just ring the triage line and we can always answer your questions, and it's again a 24-hour line. Gaining advice again, and as soon as you have any of these, you need to phone us. So I'll just reiterate the importance of the temperature, but also you can also have an infection if you don't have a temperature, and also if you have a low temperature, it could also indicate an infection as well. So anything from 35.9, that was your temperature, you'd be ringing us. And again, with the temperature, sometimes when you put the ones in your mouth aren't the best thermometers. It's the best to get the scanning ones. The ones in your mouth normally read quite a lot lower than they would normally. So if you feel cold or shiverish, if you've got an unexplained or a new pain, you can phone us. Severe constipation, ideally we would like you to phone us if you haven't had your bowels open for about two days. Abdominal pain, if you've got any sort of urinary problems, if you've got any pain when you're passing urine, if you're going more frequently or it's just not normal, give us a call. Bleeding and bruising, we might need to just take your bloods and just check that all of your blood markers are okay, because when we have chemotherapy it can reduce these and then you're more at risk of bleeding and bruising, so we just need to check that as well. If you're feeling that you're unable to do what you would normally do, if you're struggling to get up, if you're sort of spending more than 50% of your time in bed and that's not normal for you, then you'd give us a call. Again, we've already mentioned about the nausea and vomiting. It's important with the nausea as well, with the chemotherapy, that you make sure you take your anti-sickness tablets even though you're not feeling sick, as pre-planned after your chemotherapy, because that will really help you. And if you've got any sort of disorientation or a little bit of confusion, that can be an important marker for infection as well, so you'd need to be phoning us. So again, just to reiterate, so we manage the treatment side effects, and again, it's the 6-week criteria. So if you do phone us and you're out of the 6-week window, and when you're on chemotherapy or radiotherapy, we'll try and direct you to where we feel is appropriate based on your symptoms. And again, if you're on immunotherapy, it will be a year, because your symptoms and your complications could be further than 6 weeks. Again, yeah, so signposting you to the appropriate healthcare professional. And also, if you live in Northampton or Kettering, when you phone up, we would advise you to go either to us, to Kettering, or to Northampton A&E based on the symptoms that you attend with. So with our unit, we're an ambulatory service, we're not an A&E. So if you phoned up and you were quite unwell, we would need to direct you to where you would be most appropriately looked after with the best healthcare professionals and their speciality there. And again, the triage line. So any issues or any concerns, or you're just a bit unsure about treatment, about side effects, how you're feeling, just give that number a call.